that will be far more difficult and complex than any before, given the continued prevalence of COVID-19 and the need to prepare our hospitals and our entire health system, both within the community at primary care level and in the acute hospital setting, for the winter, the normal winter surge in terms of emergency admissions, and how our hospitals can cope with that, given that the COVID-19 virus will be prevalent. And so we had a very good productive discussion in relation to that. We also discussed, of course, the necessity for the resumption of services to deal with non-COVID illnesses, diseases, the diagnostic waiting lists, and to see how best we can deal with the non-COVID strand of medicine, given again the constraints that COVID-19 is placing on our primary care, community care and acute settings in the hospital environment. Above all, I came here today to talk to the HSE in general and to staff across the country, which we did, and to thank them on behalf of the Irish people for the extraordinary work that they have done at the front line to combat COVID-19, to help many patients, help many families. I think we all saw in the RT Investigates programme behind the scenes the extraordinary work that our healthcare staff performed above and beyond the call of duty, not just in relation to treatment, but in terms of liaising with families at times of a great trauma and grief for those families. And the multidisciplinary commitment and contribution that was on evidence, I think, was quite extraordinary. And I think our healthcare staff and the HSE in general, through the uniformity of its delivery, the national remit, I think instilled great confidence in the Irish people that notwithstanding the fears and anxiety in advance of COVID-19, that our service was able to cope with it, and that our acute system was not overwhelmed by the virus, as indeed it was in other countries. And so I took the opportunity today to thank the staff in particular. We've also discussed, of course, the continuing situation in relation to the virus, and again we urge people to adhere to the very basic principles in terms of preventing the community transmission of this virus. Good etiquette in terms of hand washing and in terms of social distancing and behaviour. I can say that in relation to masks, as in from Monday, the wearing of masks will be compulsory on public transport. The regs will be signed later this evening and will come into effect on Monday next. And we encourage people outside of the public transport system, we encourage people to wear masks in crowded indoor gatherings, and again where social distancing is not possible. But it will be compulsory on public transport as and from Monday. We will take advice from NEFIT in relation to the commencement of phase 4 of the reopening. There is concern about indoor gatherings and the degree to which those indoor gatherings may be causing an increase in the prevalence of the virus and leading to its spread. And there's also concern about travel-related incidents of the spread of the virus. Our approach to date has been very cautious in relation to travel, and as we said last week, we will be dealing with that on the 20th of July. We will take further advice, monitor the situation. We've developed a methodology, and we've a range of measures that we're working on before we announce any green list in relation to travel. But we will be taking a very cautious approach to it because the overarching priority for us moving to the end of the summer is to get the schools open. And considerable work is underway with all of the stakeholders in education. And we do need, for the sake of the children, their development, their life chances, to have schools reopening towards the end of August. We're learning lessons from other countries as well in relation to that, and we'll take on board their experiences. And that's a very important objective of government. And secondly, as I said earlier, dealing with the non-COVID strand of medicine is very important as well. For both of those objectives to be met, we need to keep the community transmission of the virus down. and that is why we will be cautious on the travel issue insofar as we can be within our jurisdiction.
In relation to, I suppose, the overriding concern in terms of travel is that the North has opened. I think you've expressed concern to the BBC this morning. I mean, are we minded to mirror what the North have done, or what can we do to ensure that there isn't a sort of an increase in the prevalence of the virus here?
We will obviously take our advice from NEFIT in relation to that. We've already outlined our approach, which is different to the UK approach, which is the approach that's been adopted within the North. Our public health officials are very concerned about the potential of travel and the reopening of travel to impact negatively on the transmission of the virus. So we will be taking that on board. And we will be meeting with the First Minister and Deputy First Minister next week, and we will discuss these issues, because I tend to agree with Professor Scally that ideally an all-island approach to these issues is probably optimal. There are challenges in that regard, obviously, but our public health officials are not comfortable, to say the least, at the moment in terms of the travel issue.
I suppose on the mandatory face mask for next Monday, how is that going to be policed in practical terms? Will people be stopped getting on, say, a bus if they don't have a mask, and what if they just sit on, they take it off? What happens then?
Well, my own experience, by the way, in terms of laws in general, is the first thing is got to get the law enacted, signed off, because compliance does follow that. It's an interesting phenomenon. You have to build up compliance, as in all public health measures. If you look back at our entire experience throughout COVID-19, it's been really developing compliance, engagement, and people themselves have come with us on that journey and have come with the authorities. But there will be clear in the regulations, the National Transport Authorities will have the authority and the capacity to say to people, you may not come on if you don't have, or if you're not wearing a mask. And of course, if people persist in disobeying, then the Gardaí can be called. But again, we don't envisage that having to be necessary. My experience has always been from earlier times that once you say to people it's not against the law, people will actually conform. And basically people will not be allowed to stay on buses without a mask, or on trains either, for that matter. Sorry, sorry, Richard. Yeah.
What we heard yesterday from NEF in terms of the reproduction number going to 1 or above 1, the increase in cases we've seen in recent weeks. How concerned are you about the potential over this weekend, more similar scenes to what we saw last weekend in terms of breaches and pubs, as well as large crowds gathering once again?
Well, we are concerned about that, and we were concerned about the breaches last week. I applaud the Gardaí. They've taken cases, they've highlighted certain establishments that from the Gardaí's perspective were in breach of the law. The Gardaí will be out and about again this weekend to prevent a reoccurrence of what happened last weekend. I would appeal to people. People have been extremely good and effective in complying with all of the guidance from the public health authorities from the outset and from the government. And we appeal to people to continue that. It's been difficult. It's been a difficult journey for people. But as we have reopened, I think the responsibility is on us all personally and as groups to just behave responsibly, particularly in terms of gatherings and in terms of social distancing. And one can still enjoy oneself. But this is a very dangerous virus. It can damage people's health for quite a long time in some instances. It's not something to be taken lightly, as we've seen in the various analysis from the medical world and indeed from people who've had the virus. So it's extremely important that we try and prevent as many people as possible from getting this virus. And that is why we appeal to the public, really, to adhere to public health advice and to behave responsibly. We all have a personal responsibility in relation to stopping the spread of this virus.
Separately, on the National Children's Hospital issue, there's a new controversy over that. The construction is stalled due to the coronavirus pandemic, and there's been calls for your colleague Stephen Donnelly to take charge of the situation. The contractors say that they've been excluded from payments that have been given to other construction firms and public sites. But to help with the reopening, what's the government going to do to get that project back on track?
Well, the first thing, I think young people have had a very difficult summer. And they've had a very difficult number of months, both with the leaving certificate, the whole change in universities and Institute of Technology. There's been a lot of transformation. The fact that students couldn't get abroad this summer. So we have to take all that into account. That said, the same advice applies to young people as to everybody else. The indoor gatherings are a problem. Overcrowded house parties are a problem. And no one is invincible. This is a dangerous virus. And I said to all people, young and old, to be very, very conscious of that. And just with clever precautions, young people can still enjoy themselves without having to put themselves in harm's way. But the indoor gathering is becoming an issue, and it's worrying our public health doctors and public health advice to us now, and I think it'll probably strengthen before the week's out, that concern about congregated settings and sort of indoor crowded gatherings is one we're going to have to look at very carefully. And again, it's back to personal responsibility. In relation to the National Children's Hospital, I'm quite annoyed at what has transpired here, in the sense that why is it a Children's Hospital site, one of the few, if only, site that work hasn't recommenced on? Work has recommenced on construction sites all across the country. People have got back to building. It's unacceptable, in my view, what has happened here. And I would say to people, get back on site and start building the Children's Hospital, because the children of this country need it. A lot of investment has already gone into it, a lot of effort. And the only objective has ever been that the children of Ireland would have a first-class health facility that could really genuinely cater for our children in a world-class environment. And I'm angry about this, and I think they should get back on the site and start working. I'm not interested in excuses. I'm not interested in what people are saying and blaming. If they have the interests of the children of Ireland at heart, they should get back on the site and start building. That's my message. I know that's the point. I'm fed up with claim and counterclaim. I'm saying to people, get back on the site and start working.
If they don't, and if this rail can't be resolved, would you consider re-tendering?
Well, I mean, these are matters that the health authorities, in terms of the board itself that's responsible for the hospital, will be advising the department and of course the government, and we're actively obviously over this. But that's my plea is very unequivocal. It's very simple. There are sites all over Ireland have reopened, and I think we've just had enough, really, in terms of what's going on at the Children's Hospital site, and the children of Ireland deserve better than this, and I'm very clear that I think they should get back on site.
So will the state continue with that?
I've said what I've had to say. I'm not going to sort of contractual issues here now.
Go back to the discussion about the concern you've had and looking at indoor gatherings and issues like that. Is there a chance that phase 4 might change in light of that? Because that does seem to be a growing concern. And as well as that, there's been a lot of anger expressed on social media about flights coming in from different parts of the world, Texas, for example, this morning. Surely that's not right at this point, given what's happening.
Again, in terms of, from the very outset, we've been very strong in terms of the travel advisories. Non-essential travel should be avoided. In preparing for the 20th of July, we will have an additional number of measures at airports and at ports designed to check and to protect people as best we can. I understand there was 16 on that flight today. And again, they're clear. They have to fill in the passenger location form. That will be followed up on in terms of their locations. And we'll be working more proactively in that regard and putting in systems that will be more proactive in tracking people who come into the country. They have to restrict their movement for 14 days after arriving into Ireland. And that's something that we will be far more proactive on in terms of additional measures.
And just on the question of whether the next phase is likely to be delayed?
Well, again, we will take advice from NEFIT in relation to that, but from the discussions I've had already, there are concerns around that, so certainly we will consider the full advice that we receive from NEFIT in relation to phase 4. As you know, all phases are subject to review, and I think that has been said consistently from the beginning. If something isn't working and if something is going wrong, we have to intervene to correct it.
Tell us some ads we're seeing on the television or the internet. I saw one today where away, $24.99. And obviously not talking about Ballybunion or anything, but if people are going away and coming back, it's huge danger. We're not ban the ads, we're not put health warnings on the ads,
we still live in a democracy, but I mean, I think Ballybunion would be an excellent location for a holiday, and you should consider it. It's go to Donegal, of course. Yeah. But no, seriously, I mean, it's holidaying at home. I think is something that would boost our own tourism industry and boost our own hospitality sector. Again, public health advice has to be supreme here. From the very outset of the virus outbreak and the pandemic, the idea of public health advice being the key go-to reference point in terms of how people should behave remains. It's not airlines dictate public health policy. It's the government, the state, through getting informed advice from the public health officials and working that through in a practical and implementable way. And that's the way it will continue. And there's no getting away from the fact that travel poses risks. International travel, poses risks. That's very difficult for the airlines, to be fair. It's very difficult for the aviation industry in general. But the facts are the facts, and we have to deal with them. Okay.
Sorry, can I just ask you back to the mask? So the regulations turned off on tonight. From Monday morning then, obviously we don't have transport police. Are we asking bus drivers to refuse people?
No, there will be clear protocols in terms of how this works. But again, I think, I know from experience, compliance is a science in itself. It's not about going in on day one and sort of, going very hard on someone. It's about building up compliance. It's about proper notice to the public. It's about proper awareness campaigns around it. There will be a communications campaign around this. That's how compliance works in the ordinary way. There are professionals who can do this, and that's the most effective way to do it. It's only in exceptional circumstances that one should have to have recourse to the guards and to taking somebody on in terms of their transgressions, and that ordinarily the vast majority of people will comply once the law is in on Monday.
Taoiseach, is the government having interacting with international airlines like American Airlines who have resumed flights from Ireland to Dallas, where there has been a recent spike in corona cases? Like, it doesn't seem to make sense.
It's an issue that the government will keep under constant review, but the government, we have established and will be establishing clear protocols at the airports and at the ports, and the health department are coming back to us in relation to a variety of measures that could be taken to strengthen our presence and activity at the airports and ports, and also our interaction with airlines and protocols with airlines as well, because to be fair, airlines have also engaged in devising their safety protocols to try and make travel as safe as possible from their perspective as companies. Okay? Thank you.
Yeah, sure.
First of all, just on the National Children's Hospital, what's your response to the ban statement? They're claiming that COVID payments that might allow them to proceed are being made to companies. So what's your response to that?
My response is to please get back on site. My response is that on pretty much every building site across the country, contractors and builders are back on site. I met with the chair and the chief executive of the board this morning. I am confident that they are doing an excellent job. And I very much want to see the contractor back on site. There are ongoing issues, there always will be, between boards and developers. There are processes in place for those to be resolved. The very clear message is, please get back on site. The children of Ireland need a new children's hospital, and I don't see how anything is served by this ongoing delay.
And just, do you have any words of caution heading to the weekend for people who might be trying to provide a good person?
Yeah, look, people have had to stay at home for a long time, and then when everyone started going out again, it rained on us for about 3 weeks, and it's sunny. So go out and have a good time. People need to have a good time, but please, please, please maintain social distancing. There is no issue with people going out, meeting their friends, going for food, no issue at all. We just need to maintain social distancing. That's from a public health perspective. That's the ask. The other ask, I'd say, is please download the app. I checked about 2 hours ago. More than 1.1 million people have already downloaded the app. Every single person who downloads that app steps up as part of a national response to keep everybody safe. And the testing and tracing people have said they're already using the app. They were expecting it to take a bit of time to kick in. It's already helping to identify close contacts. So have a great time. Please comply with public health guidelines, and please download the app before you go out this evening.
Where are we on the 60% target? What number of people we need to get to?
The 60% is not a target. It was never a target. It is a figure from a UK research project about something else that said if you had no national infrastructure in place whatsoever, this is theoretically what might be used. Somehow that became a target. It's not a target. The people who developed this, and huge effort has gone in, are absolutely delighted that already we're at 1.1 million. At a much lower level, it already started to be useful. So ignore 60%. It's online. It's already working, and every single additional person who downloads it makes us all safer, makes it possible for people to go out, makes it possible for phase 4 to commence, makes it possible for the schools to reopen, makes it possible for people to get back to work.
Minister, are you concerned about in phase 4 the potential impact of the general reopening of pubs?
It's something that NEFIT are going to look at very closely. Obviously, we all saw what happened last weekend. We know there are issues of non-compliance. However, the vast majority of people going out and the vast majority of businesses are in full compliance. It's a very small number. NEFIT are taking it very seriously, and they will be making recommendations to government next week on phase 4, including those issues.
Is it possible the majority of phase 4 could move on, but maybe pubs reopening could be delayed further?
I don't want to speculate. I want to hear what the public health experts have to say. Beg your pardon?
When will that recommendation actually come?
I believe I'll have a letter on my desk on Thursday evening or afternoon.
Minister, rural pubs in particular feel like they have been unfairly targeted for larger pubs in cities like Dublin. Flouting the guidelines, and if a decision is made to delay the reopening, they feel that this will be completely unfair. Will there be certain exemptions made, or will it be made on a case-to-case basis?
No area or type of pub is going to be targeted. It's very simple. There are very clear laws in place. There are very clear public health guidelines in place. They just need to be complied with. And again, the vast majority of pubs and restaurants and people going to pubs and restaurants are complying. We just want to make sure that the incredible work and the important work that has been done by so many isn't ruined by a small number. That's what the public health officials are looking at, and obviously from an enforcement perspective, that's what An Garda Síochána are looking at as well.
Can I just come back to the National Children's Hospital again briefly? Is this going to cause a further delay, and if so, how much delay?
It's unknown exactly what the outcome of this is going to be, but the message is very simple. Please come back on site. Get back building the Children's Hospital. It is the case on every building site that I'm aware of everywhere in the country. All right, thank you.
Thank you.